Everyone, welcome to the January 27th edition of the weekly COVID-19 situational update. Very happy to have you all with us today. Thank you especially to our elected officials who've been able to join us today and the media who have been such a great partner through all of this. We will get underway and start off with a moment to pause and acknowledge the land. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, I'll now invite our board chair, Mayor Andy Mitchell, to start us off with some opening remarks. Please go ahead, Andy.
Thank you, Brittany. I want to begin today by extending my condolences to the families and friends of those impacted by the recent deaths from COVID-19 in our community. So far in January, we have lost 16 souls. Local deaths are now beginning to mirror the experience across Ontario. These deaths, and thousands across Ontario and Canada, and everywhere, are so tragic, so very sad, and so very heartbreaking. The efforts of Peterborough Public Health to limit future deaths, hospitalizations, and cases continue. Good progress continues on the vaccine front. So far, 321,507 doses have been administered to over 121,000 people in the Peterborough region. Most adults in our community have begun an immunization program. 89% have 1 dose, 87% have 2, and 58% have 3. We now have had 50% of our younger children, 5 to 11, vaccinated with a first dose. And among older children, 12 to 17, 82% have had a first dose. You wouldn't know it from what you see sometimes on social media, but Ontarians have embraced vaccines for what they are: the best way to protect themselves, their families, and their communities. Almost 92% of Ontarians aged 12 and over have received at least 1 dose of vaccine. More people have been vaccinated in Canada, over 32 million, than almost anywhere else on a per capita basis in the world. The measures that were implemented in late December, designed to reduce contacts, have begun to have an effect. Case counts seem to be declining, and this will hopefully lead to a reduced strain on our healthcare system. In response, starting Monday, the province will begin to cautiously lift public health restrictions. This is welcome news for residents and for our many small businesses that have been impacted. As we move forward, it will be important to continue to be prudent and practice appropriate public health measures. Adhere to indoor and outdoor social gathering limits. Adhere to capacity limits when at stores, facilities, or other indoor venues. Wear a properly fitting mask when indoors or outdoors when you cannot maintain a physical distance of 2 meters. If you are ill, stay home and do not go to work or school. And please follow all isolation protocols. This has been a difficult few weeks, but increasing vaccinations and public health measures are making a positive difference. To all of you stepping up, thank you. Stay well, be safe, and in all things, be kind. Thank you.
Thank you so much, Mayor Mitchell. Okay, let's have a look at the data. So I'll turn it over to our Medical Officer of Health, Dr. Pigott, to lead us through these next few slides. Go ahead, Dr. Pigott.
Thanks so much, Brittany, and good afternoon, everyone. I hope that you're well today. I'll begin with a data update for you all on the situation, and I'll begin with vaccinations, our continued good news, and the continued work our team and our partners in the community are doing to make vaccines accessible and get them out there is working. We're almost 2% higher in third dose coverage than we were last week in those 18-plus-year-olds, and I'm, continuing to pay close attention to the under 5-year-olds. We're seeing good progress with that group, and now with at least 86% of those 5 years and older having received a first dose, but there's still lots of progress to go. So you can see here on this slide, with 1 dose coverage at 51%, we know that means that nearly half of people still haven't started out on a vaccine course in the 5 to 11-year-old age group, and lots of room for improvements. So looking forward to that, and we're trying to make it more accessible. And we know that getting vaccinated continues to be really important for children in order to keep schools open and as safe as possible through this pandemic. On this next slide, you can see that this is a picture showing how protective the vaccine is for the intensive care unit, hospitalization prevention, as well as prevention of infections. This is a figure from the Ontario Science Table. And of note, in recent weeks, we're now seeing the improvement in prevention against infection. And the improvement now is creeping up to back towards 60% effectiveness in individuals with at least 2 doses. And I believe what we're seeing here is the protection that 3 doses is now giving us. So we always knew that 2 doses was good, but 3 was better at preventing severe disease, including death, ICU admission, and hospitalization. But I'm very encouraged to see the performance of the vaccine appears to be increasing as more people get their 3rd dose. And the protection of the vaccine has gone up into a level where it really is playing an important role in stopping infection, not just people getting very severely sick. On the next slide, I want to mention the walk-in clinics that we are now operating because we want to make vaccines as accessible as possible. So this week we've opened up more walk-in appointments, and individuals in all of these groups can now walk into our clinics. There are designated age groups, so be sure to walk into the appropriate clinic, and at our website /vaccine clinics, you can find more information on those. But we really want you to come out and get the vaccine and make it as easy as possible. I'm also excited to share that yesterday we celebrated 1 year of administering the COVID-19 vaccine in the Peterborough region. So a huge shout out to the community for stepping up and receiving more than 321,000 doses of vaccine in this year. And that really is a remarkable feat. On to our next slide, we can see the number of active cases, which is much lower than it had been. But a reminder, it is essentially meaningless and the tip of the iceberg of what is actually out there circulating because of the changes in PCR testing availability and criteria. So we should continue to take significant caution in this number. And we are now relying on other pieces, including our wastewater surveillance, the hospitalizations and deaths, and we continue to see a significant burden in those areas. We will shortly have Dr. Kyle from Trent University speak about the wastewater surveillance program, but I continue to be very concerned about transmission in the community, a high burden on our hospitals, and the increased death rate, which is very concerning. The increased death rate, which I spoke to last week, has meant that and today we will report an additional death, which will bring our total up to 47. This has meant that nearly half of the deaths that we've had in the pandemic, through the whole pandemic, have been in the past month and a half of the Omicron wave. When I began at Peterborough Public Health, there were nearly half the number of deaths at 25, and we have seen this number increase because unlike previous waves 1, 2, and 3, where Peterborough managed to have a far, far lower rate of infection, we have matched the Ontario average in a bad way this wave in Omicron, and we have seen the proportionate deaths increase accordingly. And we have also borne a disproportionately bad impact on our community through deaths in the Omicron wave because of the underlying vulnerability of our region with an older population and individuals who have more risk factors for severe disease. So we've reported now 6 additional deaths since last update, and this does continue, and I am very concerned that the death trend will continue because it lags behind transmission over the next few weeks. On to the next slide, we are also sharing that there's currently 21 inpatients with confirmed COVID in addition to others who may have COVID. They are managing 1 outbreak and have received a patient in transfer. And I want to share the message with from our hospital partners who couldn't be here for today's call, that they continue to be deeply concerned about the situation in the community, the impact of COVID-19 on hospitalizations and deaths, and the impact on their own staffing and the pressures that that has created with staff isolating because of infection or as close contacts. On to our next slide. This slide again shows the age distribution of cases, and I continue to really implore people who haven't got their 3rd dose, especially younger folks, to go out and get it. If you are 18 plus and eligible, we really need you to come forward, and we need you to recognize this is a 3-dose vaccine, because the cases that we continue to see are disproportionately in younger individuals and people who are not vaccinated or not fully vaccinated. On to our next slide, you can see that the number of active outbreaks has declined slightly from 19 to 16. That's cautiously optimistic news, and a big thank you to all of our partners in the congregate care settings, retirement residences, and long-term care who have been taking these matters incredibly seriously and making sure that residents are protected. We have also been working with them to ensure that at the same time as we prevent transmission of COVID in these settings, residents are not unnecessarily isolated for prolonged periods of time, and that we are reasonable and measured, and that we make sure that residents can continue to have, good quality of life and the attention that they need as they progress through this Omicron wave and these pandemic. On to our next slide, I am going to introduce Professor Christopher Kyle from Trent University, and he has been leading our surveillance efforts around wastewater over the past period of time in the pandemic, has been doing a tremendous job. It's been a wonderful collaboration and a real pleasure personally to get to know him and the work that him and his team has been doing. And I wanted him to share directly some of the evidence and a bit of information on this, because I think it's really relevant now that case counts, especially now that case counts are not as meaningful. With that, I'll turn it over to you, Professor Kyle. Thank you.
Thank you very much for the introduction. I'll just get my presentation queued up here. Perfect. So I'll just assume that everybody can see the screen and introduce myself. My name's Christopher Kyle. I work at Trent University. I'm a professor in the Forensic Science Department, but I also run the DNA Center at Trent, and we've been lucky enough to be part of the Ontario COVID-19 wastewater surveillance program that's sponsored by the Ministry of Environment, Conservation and Parks. And specifically, our work covers Peterborough, Belleville, Millbrook, Lakefield, Norwood and Havelock wastewater treatment plants now. But we also do some work at residences at Trent, Fleming, and several retirement homes in our community. And so what today's talk is going to be about is really, there's increasing interest in the wastewater work right now. So we want to tell you how it works, what the data do and do not say, because there's some important provisos and that we need to make as we project these data and use them for public health measures or to inform public health. And then I'm going to wrap up with some of the actual data that we've been getting in our community. So I think these first pictures demonstrate some of the work that's happening. This work's happening in a slightly colder environment for my field crew, who is amazing, and I want to thank them just as we get started, but also my lab crew that's worked extremely hard to get next day data to public health, working some really long hours. And I'd like to acknowledge all the wastewater treatment facilities that are working to give us these samples, And then finally, public health has been a wonderful partner. Dr. Salvatierra and now Dr. Piggott have been just great advocates for this work, and I appreciate that support and your teams that assist me. So for a facility, we'll try and map out using information from both the facility and the city, and map out a sewer that actually links to a particular building. We'll then put a line down into the sewer. We've got these machines that are taking about 100 mils every 15 minutes over 24 hours for a composite sample, because every little flush is important to us as we're trying to detect COVID. We'll then take a small subsample of about 1 liter, and then that goes to the lab. So what do we do with these data? So how we detect the virus that leads to COVID? Well, I think there's important components here. We need to acknowledge that we've got both asymptomatic and symptomatic shedders. So some people are feeling perfectly fine, especially in the younger demographics. And then some people are highly symptomatic, but both are shedding virus from their feces. And that, when you're on a sewer system, is going to the wastewater treatment plant. And they're taking these composite samples, similar to what we're taking at the field sites, and collecting about 10 liters overall from one day. And from that, we take a really small subsample, only 80 mils, and we spin that down to get a fecal pellet. And I'm always amazed at just, of the hundreds of thousands of liters that are going through a wastewater treatment plant, it all really comes down to 80 milliliters that we spin down. And we've got Audrey here that's taking a subsample and spinning it down in the lab. We then extract the RNA from that fecal pellet, and in that is the virus that we're looking to detect for COVID. We've got Brad here adding some chemicals prior to extraction on this robot by Colleen at Dr. Doyle. And then we actually use this machine to quantify how much virus of COVID specifically is in that sample. And we're using the N gene, and I don't want to get too technical, but the N gene is a more conserved gene than the spike protein that has led to Omicron, and then that S protein is what interacts with our cells. The N gene is much more conserved, and this assay has been working really quite well across all of the different variants we've had over the last 2 years. So we quantify the virus using this machine, a quantitative PCR machine. That's Matt working diligently late at night to get the data. And then finally, Dr. Donaldson sends me the data that I try and work with him to interpret and get to public health. So like I said, it's really important to understand what these data can and cannot say. So one of the big advantages is we're detecting both symptomatic and asymptomatic individuals, because both can be infectious. This includes people that aren't getting tested. At different points in the pandemic, it was, people didn't want to get tested, or they lived too far away from a testing center, or they couldn't get an appointment. And more recently, in the absence of direct testing, there's a lot more reliance on the wastewater to see what the trends are. Another important advantage has been the 3 to 5 day precursor to symptoms for those that are symptomatic. So you're shedding virus 3 to 5 days before you're symptomatic into the sewer, and we can detect that. And if you add the slight delays in getting PCR results back, that means about almost up to a week of a precursor in the signal trends that we're going to see in the future. So that's really been helpful for public health. And right now we're actually trying to link that a little more carefully to hospitalization trends as well. So that's something that we're working on, where you'd be about 3 to 5 days precursor to symptoms. If you're symptomatic, then there's probably 3 to 5 days before you go to the hospital. So we're working on an assumption that, maybe 10-day precursor to what the trends would be for hospitals. That's a tenuous link, but that's something that we're working towards. So it also helps us evaluate public health measures on a community level, if the signal's going up or down relative to certain, restrictions on restaurants, that sort of thing. And like I said, we've been working very hard to give public health next day data and not deal with some of the delays that have been happening with other PCR tests. So this isn't all about wastewater trends in the community, but it's also really important for facilities and the residents of those facilities, including some of the more vulnerable populations, where we were able to give a bit of a precursor to signals at a residence where they could say, okay, we're going to go in and test, and we're going to try and stem the spread of this disease. or if there's a concern that some people have been into the facility that were infected, did they actually infect people in residence, and confirming ongoing non-detection. So both of those have been quite valuable, especially to the retirement homes and to Trent as we've got students returning to campus. So what do these data not say? Well, it's not invading your personal privacy, in that I don't know if it's Bob, Frank, Sue, or Jim that have contributed to the viral signal that we're detecting. And while we've got some good idea about the specific trends in the community, we cannot link to an exact number of infections. Some people shed more or less. Some people shed for shorter or longer periods of time. And so all of these things really lead to some inherent variability. I'm actually going to show you some raw data in a moment, and why we actually try and look to 7-day rolling averages for trends. But the data are also inherently challenging in that we have to control for the flow from, rainfall events or snowmelt events that might dilute our signal, and even controlling for the number of contributors or even things like industrial discharge into the sewer that might influence our results. So on to the data. So what we've got here in blue are the raw data. We've got in kind of this orange color, we've got our more normalized data relative to a pepper virus, and that's just a way to control for the number of individuals actually defecating into the sewer. I won't get into that unless you guys have questions on that, but you'll see that these two trends mirror each other quite well. And we also see that, it was really at the beginning, mid-December, when we saw the increase in signal in this rolling average. It kind of plateaued mid-January, and kind of in the last week, we've been able to say, yeah, there's a definite decrease. The signals are still extremely high, and I want to contextualize what we're observing right now with the raw data. And so we've got this insert here of the raw data, and so we can see, in November we had these little increases, and then it continued on to December, and mid-December we started to detect the increase, and up it went, and it's coming back down, but it's still eclipsing things that we would have, or signals we would have seen in the past. For Millbrook, the signals may be hanging on a little bit longer than we'd like. I understand that there might be some challenges. There have been some challenges at the school and at the long-term care facility there. And then Lakefield is showing some really nice trends. But again, in these smaller demographics, the signals can go up or down quite quickly. So I really appreciate you allowing me to speak to this work. And we're also thinking to the future and how this program might continue, and I'm hoping we can continue to expand to more vulnerable populations and give them more insight, and potentially even expand this work to other pathogens. And those are things that researchers are looking at right now. So again, thank you very much for your time, and I'll hand it back to Dr. Pigott.
Thank you so much, Professor Kyle. And I thought that was really useful and interesting for the media to hear, not only because it's very, very relevant to us as we're trying to better understand the current COVID-19 situation, but I think it's a great example of how so many individuals in the community have come together and tried to help and support the pandemic response. Professor Kyle is not a lifelong expert in surveillance of infectious diseases through wastewater. He has become one in the past year, but really, this is just an example of how people have come forward with no self-interest, but an interest in helping to support our community. And Professor Kyle, especially, I want to thank you for all that work. I think it's behind the scenes, and often we don't talk about the way that it is helpful, but I think it's just really important to highlight and share today, especially as we're trying to utilize it in a more active way to follow the evolving situation. And I think it was really interesting. You're a fantastic science communicator, and hopefully folks were able to take away some of the key messages you shared. And I know that I think you'll be able to stay if there are any questions directed specifically towards you after I finish my remarks.
Thank you very much. It's definitely a team effort with a lot of contributors, and I look forward to some questions at the end. Thank you.
Thank you. Okay, I'll continue now. And I want to come back to then the message that Professor Kyle left us with, which is that it certainly appears that there's some cautious optimism to glean from wastewater, that this virus is starting to plateau. What we might have expected, having looked at other countries, is for the number of cases to plummet off on the other side of the steep incline with wastewater. We are not seeing that. I want to be clear, we are not seeing that. We are seeing a decrease and a plateauing, but we're still seeing heavy transmission as compared to previous periods. The important piece to recognize is that continued vigilance is really important. We continue to be in a precarious situation and time in the pandemic. The decreases in wastewater are evidence that the measures that we have put in place through the public health restrictions from earlier in January and through the delays in school opening and the good work everyone has done to try to limit their contacts and follow public health guidance, that this is all evidence that that is working, but it is not evidence that we are through this yet. And there may be further increases to transmission as the relaxation of measures do come. And so I'm very reassured by the province's cautious approach to easing public health measures and the emphasis on following the data and the impact in particular on our healthcare system, which remains very precarious. We are not out of the woods yet, but my main takeaway is that what we're doing is working and we need to continue to do that. And especially in this community where we have a higher number of vulnerable individuals, we need to continue to all contribute and do our best so that we can save lives and that we can continue to protect the really critical pieces of our community and infrastructure, including schools and in-person learning. I'm going to speak briefly about absenteeism and schools and the continued response that we have to continue to track and support children, teachers, staff in schools to ensure that the safest environment possible is there. We continue to work very closely with our district school boards, and I appreciate that. One of the elements of this that we have done is that we have been looking at more than just the absenteeism data. We have shared a letter to parents and requested that individuals voluntarily submit rapid antigen testing when it is used appropriately to our survey. And you can see the link and QR code on our survey here. We follow that data that is submitted and we use it in combination with PCR tests, which are less common with the changed criteria, as well as absenteeism data to do what's called triangulating, looking at schools from multiple angles and trying to ascertain, is there transmission happening in schools? And we will continue to protect in the best way that we can, including recommending enhanced measures, including recommending the dismissal of children who may not yet be fully vaccinated to protect kids and protect students in our schools. We know that it is an additional ask and it is very much voluntary. I do want to make that clear, but we are grateful if parents can report these rapid antigen tests, both negative and especially positive. There is an opportunity to include your child's school name and grade, and we are using that data very quickly to make these decisions as to whether students who are not yet fully vaccinated should stay home for a period of 5 days if there does appear to be additional transmission of COVID-19. I want to also mention that we are also actively working with our childcare sector in order to support them as well. So please stay tuned for more information on this in the coming days. And before I finish, I just want to take a moment to personally, on behalf of myself, my family, and our whole Peterborough Public Health Organization, thank the community for the outpouring of support, kind messages, and love that you've shared in this past difficult week. It has been incredibly heartwarming. A particular thanks to Janine, Amy, and the Kawartha Now team and the Facebook group that was created. That is incredibly kind and very much appreciated. And a few things I wanted to go through and mention in particular around that. Eddie, thank you for the drawing. It was very, very beautiful. Yes, I am the new doctor who does like giving vaccines. Thank you. I want to say thank you to Ross and some of the other children who drew pictures or Photoshop pictures, including of me as a superhero, which is very kind and humbling. But I assure you, there is no superhero costume underneath this. I just went to school for a long time to become a public health doctor and am doing my job here in the community. But we do have lots of superheroes, not only on our Peterborough Public Health team, people all around the community that are doing their part and helping, frontline workers, healthcare workers, and each and every one of you who are doing your role in helping to stop this pandemic. I have a book that I read one of my young daughters at night called Our Heroes of COVID-19, and she loves this book, and it's a really lovely picture book that talks about all of the heroes, because it isn't just the healthcare providers, it isn't just public health, it's frontline workers, people in grocery stores, people in our pharmacies, people doing our essential services and utilities. It's been a whole range of people who have been our heroes in this pandemic. So she loves that book, and you should all know that you're all doing your part and being heroes as well. Thank you, Emma, for your kind picture and the affirmation that I've got this. I hope so, and we're doing the best that we can. Thanks, Matt, for your kind pics. Thanks to the Stakely Watson family for those kind pictures, and so many more that I can't go through and name them all, but I do just want to say thank you for everything that you're doing, not only the kindness that you've shared with me, but the kindness with each other. This is an incredibly difficult time in an incredibly difficult 2 years now of this pandemic. So please continue to share love and support with each other, and continue to do your best in our work against this pandemic, because it really is a team effort. So thank you, and I'll turn it back to you, Brittany.
Thank you so much, Dr. Pigott. Okay, let's have a chance to hear from our elected officials. I believe MPP Dave Smith is on the phone with us today. So if you've got some comments to share, MPP Smith, go right ahead. Oh, maybe he's...
Thanks, Brittany. Appreciate that. I am on the road right now. Someone else is driving, though, if you're hearing the vehicle. I really don't have a great deal to say today. I want to say thank you, though, to Dr. Pigott and Dr. Mixon for what I think was a very successful telephone town hall on Tuesday night. We had about 2,800 people in total who tuned in on the phone, as well as a couple of hundred through social media on it. And I think that there was some very good information that was given out by Dr. Mixon and Dr. Pigott. So thank you very much for taking the time to do that for us. I know it was well received by a lot of people. Dr. Pigott did mention that Ontario is starting stage 1 of reopening again on January the 31st. And I want to reiterate some of his comments that although there are restrictions that are being lifted, although we are able to do some things that we hadn't been able to do for the last 3 weeks, it doesn't mean that we're out of the woods yet. And I'm asking people to please still stay diligent. Please continue wearing your masks and following the public health guidelines, because we will get through this together if we work together. And the more that we work together, the sooner we'll get through this. Stay positive, test negative, because we'll get through it. Thank you.
Thank you so much, MPP Smith, for making the time while you're on the road. I know it's so busy for you. Thank you. And Mayor Therrien and Warden Jones had to duck off the call, but they do wanted to let everybody know that they appreciate being a part of this. And just a quick highlight that Mayor Therrien will be doing an Instagram live event with Dr. Pigott this evening at 7 p.m. And we also have a representative from MP Michelle Ferrari's office here with us. Cindy Paul Girdwood is kindly joining us today. So welcome, Cindy. And I'm sure she'd be happy to take any media questions back if needed. So with that, let us move on to our media guests. And we'll start with Bill Hodgins. If you've got some questions to start with Dr. Pigott, go right ahead.
Thanks. I'm just curious. with the walk-in clinics and a bit of an uptake on, you said 2% increase. How can you give us a sense of how busy those clinics are right now? Like, I don't think people really understand with Omicron. Has it died off? Is it still just crazy in there? Can you give us some sort of sense?
It still continues to be very busy, and our whole team's doing tons of work. We have had a very busy month of vaccinating and are doing way better than I even hoped that we would have been able to do. We through the 2 weeks around the holiday period, went up from what we were anticipating to a 6-fold increase in vaccine appointments, and through January have doubled what we were planning on offering, which has involved bringing lots of staff in and extra help. We're now starting to feel a slowdown to that demand, which means that we can accordingly decrease some of the staffing, and it is a little bit less busy than it had been. That slowing of demand, though, is also somewhat disappointing, because it means that there are still loads of people who we need to vaccinate, but people who really wanted to come forward for the vaccine have already done so, and we are now trying to make it as accessible as possible through walk-ins to catch people who we haven't otherwise. But with only 58% of adults 18 and older having had 3 doses, we know there's a lot more potential individuals out there to get vaccinated, and it won't be quite as busy and steady as it has been in the earlier parts of January, but I'm anticipating we'll be able to continue offering lots of vaccination support through February, so that people can still come forward and walk in. You have to remember as well that there was also people who through the last couple of months have began their vaccine journey, gotten their first dose or gotten their second dose, and it's never too late. We want to encourage people to come forward if they haven't already. But the work of vaccinating will continue in other ways. We are anticipating third doses to be available for other populations, such as those who are under 18 years old, and we are eventually anticipating a vaccine to be approved for those under 5. But at this point, we're still waiting and hoping that will come soon, and preparing so that we have capacity to be able to address that demand as it does arrive.
Excellent. I think you answered my first, second, and maybe third question there. So thanks. I'm good now.
Sorry to preempt you, Bill. It wasn't my intention, but okay. Glad I could help.
Thank you very much, Bill. I'll invite Reg Watson if there's any follow-up questions from the Examiner or Peterborough this week. Reg?
A quick question then for Chief Gilbert or anyone else in law enforcement. Just wondered, is the police going to do anything regarding the scheduled gathering early Saturday morning at Crestwood Secondary School? Has the school board approached police to get involved with that situation? And just any general comments on whether you expect any, traffic disruptions or anything like that related to the truckers convoy this week. Thank you.
Thanks, Reg. I think Inspector John Lyons is with us today. So, John, are you able to take that question?
Yeah, most certainly I can, Brittany, and thank you for the question. So essentially, we are aware of some information out there that there is not information that there's going to be any vehicles from the convoy necessarily, but definitely, we're aware of a situation where people may be gathering to go to a location where those vehicles may be. But we definitely are working with the school board. We're always monitoring any of this information that comes to our attention, and we work with them accordingly. If there's a presence required, we'll certainly be there, and we're always prepared for whatever that may be. So I hope that answers your question, Reg.
Yeah, that's great. Thank you.
Welcome.
Great. Thank you very much, Inspector Lyons. Okay, let's turn it over to Paul Rellinger from Kawartha now. If you've got some questions, please go right ahead.
I do, Brittany. Thank you. For Dr. Pigott, we've been in and out of waves throughout this pandemic, and how do you balance, it's a good thing that we're easing restrictions, obviously, but how do you balance the fact that after each time we've done that, there's a real temptation for people to get lazy, not do what they're supposed to do, and then we're right back to where we need to be, where we've been. So what's your message to people as we come out of this situation right now, and on January 31st, there's going to be an easing of restrictions?
Thanks, Paul. And I think my answer to that would be, we talk about restrictions, but restrictions are all very different depending on what we're talking about. And it's important to break things down. And the way I'd often communicate and divide them are restrictions that don't really impact us negatively and that we can continue to do easily, and restrictions that do have social, economic, societal consequences, right? Impacts on businesses, impacts on community activities, social isolation. These are all impacts that have had a negative impact through the pandemic. We've done them because we've had to. We've had to do it to save lives. And it makes sense that as the situation allows, especially as the health system is not exceeded and the capacity is not ready to potentially handle more cases if they do arise, it makes sense to ease restrictions that have negative impacts, like I mentioned. But it doesn't make sense to ease off on things that you and I, each of us, can do in our day-to-day lives, such as continuous strong use of a tightly fitted mask, such as making sure that we are ventilating our spaces, and even if that's natural ventilation in your own home, if you're having somebody over within the guidance limits, cracking that window, cracking that door even once an hour, such as staying home if you are sick, and that is critical. We know that some people can transmit even without symptoms, but the most worrisome are people who may be going out and about if they are sick, because they could potentially infect others. And so there are things that we can continue to do, and that I would implore the public continue to do really well at a personal level that can help to prevent the spread. And again, a lot of this is about risk, and some people will have different risk tolerances. Some people will have loved ones or themselves be elderly or at risk of more severe disease, and those individuals will need to be more cautious for the upcoming period. Some people, like me, have young kids who haven't had their chance to be vaccinated yet and are more concerned, and they should be more cautious as well. But I think it has always been, through this pandemic, a balance between the measures that can have negative impacts and trying to ease those as it's possible, while continuing the measures that we know have very little impact but are still helpful to prevent the continued pandemic.
Thank you for that. And just one more thing, Dr. Piggott, if I may. Tuesday, we marked a bit of a milestone of sorts. It was 2 years since the first case of COVID in Canada was detected at Sunnybrook Hospital. I just want to get your reflections. And you may not remember exactly where you were when that kind of happened, but your thoughts at that time. Nobody could have kind of foreseen what we've gone through, but what was your thought process at the time? COVID was in Canada, and here we are 2 years later.
I've learned a lot in the intervening time and years, for sure. But by the time we had our first case in Canada, I'd been tracking this for 3.5 weeks. As a medical officer of health, we are on listservs and get communication sometimes even before it hits the media. And so when the first cases of a new pneumonia were identified in Wuhan, China, I remember exactly where I was when I was reading those emails and that messaging. And I was very disturbed by the early events that we saw there. In public health, one of the challenges is always reacting early, but balancing that with the public's concern that we're overreacting and doing too much. It's something that we call the prevention paradox. You're darned if you do, and even more darned if you don't. And so I very much remember those early days, my own concern, our efforts to really mobilize and make sure, where I was working at the time in Labrador, that we were ready for the pandemic. There was important work to make sure that we had the infrastructure to to prevent the transmission, to test and diagnose as it happened. And I remember the first cases we had in Labrador because they were 7 days after my first daughter was born, and we had just gotten out of the hospital and gotten home, and I was planning on taking a few weeks off to be with my family, and that went through the window, and I worked every day for 6+ months, 12 to 20 hours a day, depending. It was a different and difficult period, but in those 2 years, we've come so far. We have so much more in our toolbox. We know so much more about this virus, and as a society, we're so much more ready to deal with whatever we face next.
Terrific. Thank you so much, Dr. Pigott. And if I may, just one quick question for John Lyons, if I could.
All right, go ahead, Paul.
Yeah, thank you so much. I heard your answer to Bill. I had a similar question as Bill's, but I just wanted to clarify. The school board has put out a statement saying that anybody who comes on that property without authorization is trespassing. And I just want to get, from a law enforcement point of view, is that indeed the case? And could anybody who's on that property, be they an individual or perhaps a truck or two, be charged with trespassing if they're on that property?
That's a great question, Paul, and thanks for the question. Essentially, what it comes down to is whoever the owner, the caretaker, manager of the property is, if they have the authority to make that decision, they can then make that request of us to act as an agent on their behalf. So they'd have to give us that permission to provide that information to whomever may be on that property. That would be the primary and essential thing to start with. If that permission's been given, and we've been advised that that people or persons that are on that property are not permitted, then we would certainly have the ability to act under the Trespass to Property Act. So in that particular case, if it happened that somebody showed up and they were on that property and we've been given that instruction, then we would certainly go and start that process.
Okay, so that go ahead hasn't been given yet by the school board.
We're right now in working again with them and sort of formulating this information, making sure that we're doing everything appropriately and that we are not going unprepared. So I can tell you that those particular pieces are being worked on, and we will definitely be working close with them moving forward.
Okay, and just one more thing. Would it be fair to say that, knowing what we do know about plans to perhaps do something at Crestwood on early Saturday morning, will the Peterborough Police Service have a presence there, or planning to have a presence there as a deterrent at least, or?
Well, without getting into too much around the operations of the service, again, we'll be prepared to deal with those issues as they come up. And again, we've had those internal discussions. So if there is a presence there, we will certainly be in a position to deal with it. Again, working in relation with the school board.
Great. Thanks so much. I appreciate it very much. And thank you, Brittany.
Great. Okay. Thank you so much, Paul and Inspector Lyons.
Thank you as well.
Okay. Thanks. Let's hear from Global News Peterborough. Jessica Nisnik, I think you're on the line with us. So go ahead if you've got some questions for Dr. Pigott.
Thank you, Brittany. I do have some questions for Dr. Pigott. Dr. Pigott, the latest death, when was that exactly? And do you have any information on their age or whether they were vaccinated or not?
So our tracker will actually report 2 new deaths today. And that's come in as we've been on this conference. The first is in an individual who is in their 70s. The second is an individual who is in their 50s. Both are individuals who have been vaccinated and have received 3 doses of the vaccine. But a reminder that while we have seen some cases in individuals with 2 or 3 doses of the vaccine, with 90% of people vaccinated, that is the majority of the community. And the proportion of people that we've seen amongst our deaths, amongst that 10% who have not yet been vaccinated, is far higher. It far exceeds the proportion in those who are vaccinated.
Thank you. Just going back to something you said earlier that, because people are wondering why are more people dying now? You're saying, more people are sick now than we've ever had before. But we also have the vaccines, and Omicron is also supposed to be less severe. So, for lack of better terms, the math isn't really adding up there. What would you have to say?
Well, the math is adding up because Omicron has been exponentially higher. It's been so much higher than any previous time in the pandemic. I don't have the exact proportion, but it's probably more than 10 times higher the number of cases at any given point. And you would have seen as we were still doing PCR testing, and that was still on the mounting rise of the Omicron peak, the amount of Omicron that has been out there has been so much dramatically higher than any other phase that what we're seeing is that proportion of people, even if Omicron's about half as severe as it has been, and even if the vaccine has been protecting us, which is a big reason why we're seeing it be less severe, we still end up with individuals who are amongst that small proportion of people who have more severe disease and who end up dying from this. And so that is what we're seeing now. We are seeing individuals who largely now are elderly, vulnerable due to medical risk factors or conditions, or unvaccinated who are amongst our deaths. And that is why the vaccine is the most important tool in our toolbox, but is not the only tool in our toolbox. And the other measures to try to prevent the spread of Omicron continue to be really critically important.
Thank you, Dr. Piggott. I don't know what you'd have to say. I don't know how to word this. I feel like if people who don't believe in the vaccine keep seeing people dying in the hospital with the vaccine, even though what you explained makes sense, it's discouraging them from going to get it, right? They think for some reason that they're right, that it's not going to help you.
Well, here's one where we share some information with our law enforcement side, and maybe John would have input, but we actually see more motor vehicle collisions and deaths among people who have not had a drink and drop of alcohol. And that's because the vast majority, nearly all of the people on the road, do not drink and drive. But when you do drink and drive, the risks are dramatically higher of having a motor vehicle collision and dying. And this is in public health what we call the base rate fallacy, because 90% of our community now has the vaccine and is vaccinated. So even if a very smaller proportion of that population, because of the protection of the vaccine, gets sick, gets severe disease and dies, the numbers are actually bigger because it's 90% of the population, the vast majority, who are now vaccinated. And so when we look at the protections, those are pieces like the vaccine effectiveness. So back to my slide where I shared the Ontario science table. This vaccine continues to prevent more than 95% of people who are vaccinated from going into the ICU, and even more from dying. And that's how we know those numbers when we do those kinds of analyses. The protections are significant of the vaccine, and especially so against severe disease and death for people who are at higher risk. COVID has always disproportionately affected people, some people more than others. For people who are young and healthy, there's always the chance, the unlucky chance, but for the most part, people will not die, even if they're unvaccinated and they get the infection. But especially for those more vulnerable, and even for everyone, the vaccine decreases the risk dramatically, and we've seen that. This is again what we call the prevention paradox in public health. You wouldn't know what the toll of this Omicron wave would have been, but I would say it would have been nothing less than catastrophic had we not had the vaccine and taken other measures to prevent spread.
Excellent analogy, Dr. Piggott. Thank you. I really feel that people sometimes need, like you said, the drunk driving analogy to really understand it. So thank you. And I also just wanted to say I appreciated your shout out for the thank you, and I'm really pleased that the community has offered all of this support for you.
It's awkward. It makes me blush a lot. Definitely makes my parents awkwardly proud, but no, I mean, I really do appreciate it. I think it's very kind, and it's the true Peterborough that I knew and that I moved to. So I'm deeply grateful for all of that. But I do want to say, please continue to share it around, share the love, and spread love, not COVID, to your friends, families, neighbors. This is an incredibly difficult time as we continue this pandemic, and we just need more love.
Agreed. That's it for me. Thank you so much.
Thank you, Jessica.
Thanks, Jess.
Okay, let's hear from Matt Latour, who's joining us from Freak and Oldies Radio. Go ahead, Matt, with your questions for Dr. Piggott.
Yeah, one of them had to do with just ahead of the partial reopening on Monday. I was wondering from your end, is there any concern about seeing, cases increasing again now that people will be in restaurants and at movie theaters and things like that?
Well, I would echo what our MPP Smith had said. As much as reopening is happening at an individual level, it continues to be really important to be very careful about the decisions that you make and limiting contacts and limiting spread. And from a local level, what I will be continuing to do is my job of closely monitoring this situation and protecting our community, however that may need to happen.
Perfect. And I know Trent University and Fleming College, starting Monday, to some extent, will have some in-person classes again. I was wondering if those two facilities or schools have been in touch with public health about how they can be doing that safely.
We've had conversations. I've written recommendations to them and suggestions. So there has been dialogue through this recent period, as there has been throughout the entire pandemic.
That's it for me. Thank you.
Okay, great. Thank you so much, Matt. All right, I think we have heard from all of our reporters on the line. Thank you again for joining us. Thanks again to our elected officials. And of course, thank you, Dr. Piggott, for always making yourself available for this. We will see you all back here in a week on Thursday, February 3rd and at 12 noon. So stay safe. And if you need reference for this, it will be on our YouTube channel before the end of the day. Thanks again, everyone. Bye-bye.
Thank you.
Thank you, Brittany.
Thanks.
Thank you.
Take care, everyone. Thanks. Bye.